Hey, today we're talking about trigger points in the body and how you can do some self-help at home, work on your own. So today I have some softballs. I pretty much take them everywhere with me when I travel, when I sleep. At the end of the day, they really help release knots and things in my back that otherwise couldn't get done without getting a massage every day. So it's good to get massages at least once a month. If you can get them more than that, that's awesome, especially if you have certain kinds of insurances will cover getting that done in conjunction with chiropractic or acupuncture. So what you do with these is, so when you're ready to open up some tension, the meridian points, we have many areas under the clavicle right here, this bone. We have them behind the scapula, back here in the back. Not the bony part, but there's the part between the spine. I'll show you a picture, and we get a few knots that build up back. Back behind there's about 3 different areas, although there can be more than just 3, but specifically you'll feel it. It'll be a really tight pinching sensation, and a lot of times it cuts the flow off, so it'll cut the nervous system, it'll block the blood flow down into the arms, up into the head, and down into the feet. There are also some other ones I'll be showing you pictures of that are in the hip area. So inside of the hip, you want to avoid all the bony parts, the spine, the clavicle. You want to avoid using them directly on the spine or directly on the hip bone. So basically you lay flat on your stomach or flat on your back, depending which tension area you're going to work on. For these, I'll do 2 under the clavicle, not on the clavicle, but under it, and you'll feel when you're face down, you'll be like, oh, that's comfortable, that's not, that I can feel that's making my arm go numb, or that's tingling. That's good. You want to hold that for anywhere between 3 to 20 minutes, depending on how tight you are, how much you need it. Listen to your body, you know. You can also use softballs. So softballs, tennis balls, baseballs. Some people say croquet balls are really good. These are my favorite. They just really help me personally. So there are about 3 points right here that you can press and hold for anywhere from 3 minutes apart to 20 or more, depending on what your specific needs are. But be careful not to fall asleep on it, because then your arm will go numb and you'll have like dead arm or something. But you can use like behind your shoulders, laying flat on your back. I use 2. You can even roll on them back and forth, and that'll help line up the vertebrae. But if you do have any disc issues with in between the disc, bulging discs or herniated disc, you want to really be careful, or any kind of fusing. You want to ask whoever you've been working with on that, or use your intuition. So these for the lower back, you can use them on the stomach, which is really good. We have knots, and same thing, 3 to 20 minute intervals, and laying flat on the stomach. And these trigger points in the stomach will release, and also you want to avoid the rib cage, and if you have any, like an IUD or anything, if you're a female, or any kind of implanted devices in your body, you want to avoid those. Don't press directly around them or on them as well. But this will really help open up the chi, because a lot of people get stagnant chi in their guts. It's where a lot of time we store a lot of emotional traumas, so it's good to get these worked out in the gut, and that'll also release into the back. So these trigger points correlate to the back as well. On the inside of the hips, there's about 3 different areas that you can do on the inside of the hips, which these are really good for runners, cyclists, people that are, going upstairs a lot. You have really tight legs. You want this area to be open. But be working on some of these and these that you can do at home on your own.